Hello, if you're just joining us, we are going to get started at about 5:03 to give everybody a little bit of time to get in here. If you are just joining us, we are going to get started in about 2 minutes just to give some others some time to get in here. So about 5:03, we'll get started into our content today. Okay, here at 5:03, so I'm going to get us started for this evening. So hello, everybody, and welcome to our Autism Exploration Series. I am Dr. Emily Sampone, the Director of Clinical Operations at Verbal Beginnings. Verbal Beginnings' mission is to change lives for our clients, families, and our professionals. And we do that through our pledge of care, our promise to you to provide effective treatment through compassionate care. We also strive to achieve our mission through our core values, and one of our core values is education, teaching families valuable ways to work with your child. And that's why we decided to start these series. Additionally, you'll see the seal for the Behavioral Health Center of Excellence and the seal from the Autism Commission of Quality. Both of these seals represent the hard work and focus that we place to ensure that we're providing quality care through our highest standards. Okay, next slide, please. I also wanted to take this opportunity to introduce you to the services that we offer here at Verbal Beginnings. In addition to our in-home and center-based ABA services, we also offer center-based comprehensive services, feeding therapy, and social skills programming. Additionally, we encourage you to participate with us today throughout the presentation by using the Q&A feature found at the bottom of your screen. We also offer closed captioning during this recording, which you can access by navigating to the bottom of your Zoom screen and clicking the closed caption button. Okay, without further ado, I would like to introduce you to our presenter for the evening, Liz Sheets. Liz, take it away.
Hi, I'm Liz. I am a board certified behavior analyst. I graduated from Capella University with my master's degree in applied behavior analysis in December of 2022. I have been working in the field of ABA since 2019. I am currently a clinical supervisor in the field at Verbal Beginnings, where I aim to increase the quality of life for my clients and their families by bringing ABA into their community and everyday lives. So today, I would like to know, how old is your child? You'll see a poll pop up on your screen. Okay. I am seeing the majority here is pretty young, and then we also have some children that are a little older. which is great. I work with children of all ages. So I'm really excited for you to be joining me today to talk about this topic. So, what are we even talking about? What is a community outing? It is anytime you leave your home and go out into the community. This includes grocery stores, birthday parties, dance recitals, doctor's visits, barbershops, playgrounds, hair salons, family gatherings, church, community events, and pretty much anything else that you can think of outside of your home. For example, during my time working as a BCBA, I have accompanied my clients on many community outings, including going to the barbershop for my client's first haircut ever at age 7, going to a siblings dance recital with a client whose parents had never before been able to watch his sister dance on stage for an entire performance, going to the doctor's office with a client and getting his first vision exam, going to the park with a client in an area with open fields, going to back to school night with a client and his family, going to a crowded indoor playground, going for a walk in a client's neighborhood, going on a school field trip with a client, going to an outdoor playground with a client, and going to the grocery store where walking through a busy parking lot is necessary. So, what community setting are you most interested in? I see a lot of family events. That is great. We're going to talk about all of these community outings today. So, why are these important? Why do we need to talk about this? Nearly a fifth of children diagnosed with autism have unmet medical needs due to a variety of barriers, one of which being family stress levels associated with the autism diagnosis. Similarly, 93% of children diagnosed with autism have at least one co-occurring health condition, making it easy for some healthcare needs to go unnoticed by those who are avoiding outings. Challenges with compliance are often encountered in the area of personal hygiene, which contributes to the high percent of unmet healthcare needs. Many consequences can come from poor hygiene, including illness, infection, impairments, unkempt appearance, and stigmatization. Over half of parents with children on the spectrum report wandering behavior. This adds safety to the list of barriers that families are facing when it comes to community outings. Many parents report that their child bolts or wanders and finds themselves in dangerous situations when out in the community. This barrier has been identified by parents as a reason they spend less time outdoors, despite the many benefits spending time outdoors may have for their children. Spending time outdoors can include motor, sensory, emotional, and social benefits for children with autism. Parents also report stress and anxiety surrounding leisure activities due to their concerns with taking their children into the community. This frequently leads to families avoiding gatherings and events and therefore less satisfaction with family life. What challenges are you facing with your child? You should see another poll pop up on your screen. I'm seeing that we're feeling a lot of those overwhelming feelings when we're in the community. We'll definitely talk about that today and how we can overcome that by giving ourselves a little bit of confidence in our children and our own skills. So let's talk about some strategies to help you prepare for community outings. Priming is a preventative strategy used in ABA to prepare people for a task or a situation by giving them relevant information beforehand. The goal is to prepare a person in a way that helps them succeed and promote skill development. Some ways that you can engage in priming are to visit the location ahead of time. Driving by the grocery store or the doctor's office may help your child to feel a bit more familiar with the area. Talk to your child about where you will be going and what you will be doing. Be open and honest about things that might happen while you're there. For example, there might be loud noises at the barbershop. You can play sound effects of devices that may be used at a barbershop, a hairdresser, or a medical facility. You can read social stories with your child. You can find these stories online. Your BCBA may have some stories to share with you. And there are also resources online to help you create your own. Social stories are a great way to explain to your child what will happen during your outings and what your expectations will be. You can even role play with your child to help them imagine what their experience might be like. Practice compliance with procedures in a fun way by using toys and pretending to play doctor or hairdresser with your child. This may make the experience seem less scary when it comes time for their appointments. Pretend to go to a grocery store and practice walking with a cart, staying close to grown-ups, and helping check out. You can also use priming to prepare your providers for this experience. Call your doctor, barber, or other provider ahead of time and explain your child's needs. Let them know how you will be supporting your child and ask if there's anything you should prepare for at home, like if there's construction work going on at the location, if there will be an eye exam or some other event that you should be preparing your child for. Another important part of preparing for your community outing is to prepare reinforcers ahead of time. What is your child's most highly preferred items and activities? If they like to earn a certain toy, make sure that you have a plan to bring it with you. If they like a certain snack, make sure you bring that snack with you, or you have a plan to get it as a reward at the end of the outing. If they like a certain activity, make a plan on how you can incorporate that activity into the outing to make sure that you're rewarding your child for the behaviors that you want to increase. You should always have a plan for reinforcement. How can you have a successful outing? First of all, determine what you are comfortable with and set those boundaries. For example, do you want your child holding your hand during the outing, or are you comfortable with them just walking next to you? Are you comfortable with your child taking a few steps away from you, or would you prefer that they stay right by your side? That boundary should be clear to your child. Tell them what your expectation is and reward them for respecting that boundary. The PREMAC principle is a strategy that is used to incentivize and motivate people to engage in a low probability behavior or something that is non-preferred by promising a reward of a high probability activity or something that is highly preferred. You will often hear this referred to in ABA as using first then language. This is a way of telling your child what they will be earning following their engagement in a particular behavior or activity. For example, you might tell your child, First, we will shop for groceries, then we will shop for toys. Or first, we will check your eyes, then we will play with toys. Use this in a way that your child will respond to based on their interests. If your outing is able to be broken up with reinforcement for each step, like checking eyes, then ears, then mouth at the doctor, then you should do that. If the activity is a little harder to break up, like grocery shopping, then make sure that you're giving a big reward at the end. It is most important to remember to reinforce as much as possible. Be very aware of behaviors that you want to increase and give reinforcement for them. Reinforcement is a way to increase the future likelihood of a behavior. So if you see something that you like or that you're impressed by, make sure your child knows that you like it and that you appreciate it. A way to make sure your child is reinforced for the behaviors you want to keep seeing is to give behavior-specific praise. This tells them exactly what they are being reinforced for, and therefore exactly what you want to see. For example, don't just say good job. They hear that all the time. Say, good job holding my hand in the store, or good job letting the doctor check your ears. When possible, coach your provider on how to approach and communicate effectively with your child as well. Is the barber using clippers? Prompt them to show your child these tools and to turn it on so they can hear it before it's cutting their hair. Prompt them to give directions in a way that you know your child responds well to, and ask questions in a way you know that your child can respond to. You can also ask your provider to explain things to you so that you can communicate and direct your child in the way that works best for them. I cannot stress enough how important it is for you to stand up for your child's needs and communication skills when you're in the community. You know your child best. So be your child's advocate. The best way to have a successful outing and successful future outings is to make sure that your child is comfortable in the environment and for them to know that you've got their back. Accept imperfections and celebrate your child's uniqueness. Your outing might not be perfect, but recognize what did go well. Maybe your child wasn't able to respond to questions the way that they do at home. That's okay. Remember that this is a new environment and it can be overwhelming for them too. They may have had a hard time taking all of these skills that they have learned at home into the community right away. They will need time to practice. Lastly, celebrate small wins. Maybe your child did struggle with responding to questions in the community setting, but they were able to ask for a break or to tolerate being in an exam room. That is a pretty big deal, and it should be celebrated. Taking baby steps is okay. We talked about celebrating small wins, but how can you do that? Let's talk about some goals that your BCBA might suggest to help you be successful in an outing and to prepare for future outings. You'll want to start with small goals like walking safely from the car to the store. Tolerate cutting hair with scissors, or tolerate sitting in a waiting room or an audience for 1 minute. When these small, easily attainable goals are mastered, you'll want to require a bit more from your child. Your goals might now be to walk safely through the store to the checkout line, tolerate cutting hair with scissors while the clippers are turned on in the background, or tolerate sitting in a waiting room or audience for 2 to 3 minutes. The goals can develop into much bigger skills, like tolerate cutting hair with clippers for entire haircut, tolerate sitting in a waiting room until called for their appointment, tolerate sitting in an audience until the end of an event, walking safely from the car through the grocery store and back to the car, accepting no in the absence of maladaptive behaviors, and so much more. By doing this, you will be able to help your child build the skills needed for a successful outing in a way that celebrates their growth. It is important to remember that celebrating small wins starts at home. There are many ways that you can create opportunities to celebrate small wins in any setting. If your goal is to go grocery shopping with your child without experiencing challenging behavior, your BCBA might recommend starting with accepting no in the absence of maladaptive behavior at home before you begin outings. Creating opportunities for such goals may include denying access to something your child has requested, and after a few seconds, celebrating that they have accepted this. Give them praise and access to that item or activity if it's available. This will help to teach your child that the word no isn't bad and that reinforcement will come. So you've gone on your community outing. What's next? Identify the behaviors that you want to continue increasing and reinforce them consistently. If you want to see your child continue to respond to questions, give reinforcement when you see them responding to those questions in all settings. This includes home, it includes school, daycare, family events, outings, like errands that you have to run daily. Continue to provide your child with behavior-specific praise for behaviors that you want to see, to let them know that they are doing a good job. By giving behavior-specific praise, you're also labeling behaviors so that in the future, your child may be able to follow directions a bit better because you have told them what they're doing is called this, and this is what you want to continue to see. Now reflect on your outing. What went well, and what do you want to work on? What did you struggle with, and why do you think it was so challenging? Reflect on this to help you learn from your experience. As parents, you will need to learn and practice these skills too. Remember that it is okay not to have a perfect outing. Learn from these experiences. Set goals for your next outing. What locations will you go to next? What skills will you plan to work on? How will you prepare? Remember that your goals should be realistic. Your goal should not be for a flawless doctor's appointment with a full exam. But maybe the next time you go to the doctor, your goal will be completing a vision test. Or maybe you're going to a grocery store. Instead of saying, we will have a perfect trip where I get all my groceries and there's no challenging behavior, your goal might be that your child will hold your hand while walking the entire outing. The more attainable your goals are, the more successful you and your child will be. Have any questions? let's discuss what we talked about.
So there's no questions in the Q&A box, but let's take a couple minutes here for all of you to add in any questions that you might have for Liz here. So if you go to the bottom of your screen, there's a Q&A feature there. Feel free to type in any specific questions that you have. She's not necessarily able to answer any client-specific things, but she can provide a general response to any question that you send in there. So um, we'll give you a couple of minutes to do that. And then, Liz, while they're adding in any questions, do you want to go over to that last slide? And I will just present what next month's presentation will be on while they're all working on their questions.
Yeah.
Thank you. Okay, so while you're thinking of some good questions for Liz, next month we will have Ben Sarcia, who is our director of our feeding program, Healthy Beginnings. He'll be presenting for the second time this year for us on the importance of nutrition in relation to autism spectrum disorder. So it should be a really great presentation. It's on October 15th, same time, 5 to 6. So keep an eye out in your email and on BB socials for registering for that. If you don't have any questions, I haven't seen any come in just yet, but if you don't have any questions, you are all free to go. That was the end of our presentation for this evening. We'll hang on here for a few minutes just to see if anything else pops up. But thank you so much for attending this evening. We really appreciate it. And thank you, Liz. This was really great information. Thank you so much.
Thank you.
For I haven't seen anything come in just yet.
Mm.
Recording.